Hi, it's Dr. Lena. I'm going to be talking about birth control options today, and thankfully there are a lot of different options out there. You may talk to your friends and they may like one thing, and another friend may like one thing or hate one thing, and so every woman's different. Every woman's body is different in how they react to birth control, okay? And so I like to talk about all the different options available, and I usually like to start from the top, and those are going to be your long-acting reversible contraceptives, or LARCs, and they're very effective, more than 99% effective, and that's because when you place it in your body, you don't worry about it, okay? It doesn't depend on you remembering to take something, okay, or changing something, all right? And so the IUD, intrauterine device, and the implant are long-acting reversible contraceptives, okay? And so an IUD, intrauterine device, is placed inside the office, and it's placed inside your uterus in the office, sorry, and it lasts for a long time. There's two main types. There's a non-hormonal versus a hormonal option. The non-hormonal option is a 10-year device called the Paragard. It's a copper IUD, okay, and it's very effective. And the biggest complaint that people have from that one is that some people may have a little bit of heavier bleeding and a little bit more painful bleeding, okay, or painful periods. All right, and so most people are able to just take ibuprofen and it helps with the pain, but it may not be a good option for you if you already have very heavy or very painful periods to begin with. The other type of IUD is the hormonal option, and that releases hormone inside the lining to make your periods a little bit lighter, a little bit less painful. There's a 3-year one and a 5-year option, and it's just a different amount of hormones in the IUD. So some people may want to choose the 5-year because they want a longer acting contraceptive, but may also want a very light period. Some people stop having a period altogether for the 5-year one. About the average is about 25% will stop having a period after 1 year, and about 50% after 2 years. So the longer you have the IUD, the higher chance of you not having a period altogether. And some people may want to choose a 3-year IUD because they want something shorter and they want less hormone effect, okay? And so those are the IUD options. The next long-acting contraceptive is the implant, and that's the Nexplanon, okay? And that lasts for 3 years. It's placed under your skin in the arm, either side, and it lasts for 3 years. And it releases progesterone through that time, throughout your body. It's a systemic effect, and so that prevents ovulation, all those things. And it's very effective. The biggest complaint with any type of hormone we give you is irregular bleeding, okay? It suppresses your periods. It makes it, you'll have like random spotting here and there. In average 3 to 6 months, your body will have that, okay, for the Nexplanon. Other type of overall hormonal effects that can happen anytime we give you a hormonal birth control is going to be nausea, bloating, headaches, breast tenderness, possibly mood swings, okay? And so that's with any hormone, including the Nexplanon, okay? But it's very convenient. You place it in your arm under lidocaine. It lasts for 3 years. And then we can remove it at any point too. And then the next one down would be the Depo shot. And that's a shot we give you every 3 months. It's very effective. It may suppress your periods as well as the Nexplanon and the progesterone IUD. It may make your periods go away altogether, and it's a shot that you give every 3 months, okay? And then the next one down would be the combined hormonal contraceptives, and that combines progesterone and estrogen, and that added estrogen just allows us to kind of regulate your period. So if you're needing something to regulate your periods, this would be a good option. And so that would be the pill, patch, and the ring, okay? The pill, we all know, we take a pill every day, and then you have a placebo pill for 4 to 7 days, and that's when you have a period, okay? And then the patch is a sticker that you place on your skin, and you change that every week. for 3 weeks, and then the last week you have a period, you'll have a patch. And then the ring is a soft ring that's placed inside the vagina, and you change that once a month, okay? You'd place that in your vagina for 3 weeks at a time, and then you remove it if you want to have a period in the last week, okay? And so those are the hormonal options. It has, you know, because of the added progesterone, for the pill, patch, or ring, it can also help with acne. Some people like that. It regulates your periods, and some people like it for that too, okay? And so because of the added estrogen, though, there is rare, well, that's a very loud motorcycle, there's a very rare side effect of blood clots. You hear about that, you hear from those lawsuit you know, commercials. They're very rare, okay, in your blood clots in your legs and in your lungs, okay? And that just depends if you have high blood pressure and whether you're overweight as well. That increases your risk, or if you smoke, okay? And so the other types of contraceptive that you can get over the counter would be condoms, okay? Male condoms, and then spermicide too. But of course that depends on your use and being good at remembering how to use it. And also using a condom is important to protect you from STDs, because all these types of forms of contraceptive are to prevent pregnancy, but if you want to prevent an STD, sexually transmitted disease, then you got to use a condom with a new partner, okay? Of course, if all else fails, there's over-the-counter Plan B, and in California you can get Plan B in the pharmacy without any prescription, okay? So that's, and how Plan B works is that it just prevents you from ovulating. But if you already had ovulated, it's not going to work. So you got to be careful, okay? So those are all the different common forms of contraceptive. Come to the office, we'll talk about all the different options, side effects, reveal your history, how your periods are, any medical contraindications that you may have, and then we'll, you know, get the right option for you, okay? Again, this is Dr. Lena for Birth Control.